So hello and welcome you all to Sail to MDS Dental Academy. So dear students, as we have planned, we are going to have a detailed discussion of the MPPSC past paper. This is part 2, part 1. Link is there in description box, as well as you can click on the I button above. So let's start with the discussion. So the question is the pathognomic sign of mandibular fracture. So we have 4 options: buccal ecchymosis, lingual hematoma, paresthesia of lower lip, and extraoral hematoma. Here the correct answer is paresthesia of lower lip. So remember, dear student, the inferior nerve runs within mandibular canal. So whenever the fracture occurs, particularly in the area of body or angle of mandible, the nerve there may be compressed or injured. So whenever the inferior nerve is compressed or injured, it can lead to some sensory disturbance like a paresthesia in the lower lip and chin. So here the correct answer is paresthesia of lower lip. Now, if a fracture of the jawbone involves the dentoalveolar fragment, it is known as which kind of fracture? Remember, dear student, it is a compound fracture. Compound fracture always have a communication with the external environment, and when your dentoalveolar fragment is involved, the fracture site is exposed to the oral cavity. So it is known as compound fracture. Let us see the different kind of other fracture. What is comminuted fracture? Here the bone breaks into multiple pieces. Simple fracture, it is a closed fracture. It will not communicate with the outside environment. Green stick fracture, most often seen in children because of softer bone. It is an incomplete fracture where you can see only one side of the bone is broken. Now, very important question about emergency tracheostomy. Remember, it is done at the level of 3rd and 4th tracheal ring. Why? To avoid the thyroid isthmus. Sometimes they ask about cricothyrotomy. Remember, it is done at the cricothyroid membrane. Now, pleomorphic adenoma. So pleomorphic adenoma is most commonly seen in parotid gland, dear student. Okay, around 80% involvement is there in parotid gland. Remember, it is benign, but if at all it is untreated, it can become malignant. That is known as carcinoma x pleomorphic adenoma. Now, the very important question about necrotizing fasciitis. Most often in necrotizing fasciitis, both aerobic as well as anaerobic organisms are involved. Okay, it is a kind of polymicrobial infection. If at all they ask which is aerobic bacteria involved, it is Streptococcus pyogenes, and anaerobic bacteria, it is Clostridium perfringens. Okay, dear students, so that was all from my side. See you with the part 3. If anybody wishes to join our series for the MPPSC preparation with the GK help also, the information is there on the screen. Till then, dear student, take care, work hard. Any problem, let me know.